and it's time for the discussion, and the coordinator informed because we started late. We have 3:30 to conclude the session. So I will be inviting one after the other. So we are almost 3:10. Each person about 6 or 7 minutes. If we go, we can conclude, give opportunity to each paper. So I would invite the first paper, Dr. Arpita Das, to come to the podium, and her paper is on effectiveness of survivor-centered multi-pronged approach for addressing sexual and gender-based violence in Bhutan. Anyone having questions, comment, the paper is open to the public.
Thank you so much, Dr. Noor. It's a very good question because we took that purposive sampling, those who involved in the interventions, to know about that this intervention was effective from their lens. But as you have mentioned that if we could do kind of case control kind of thing, those who are involved and those who are not, maybe in the scale up phase, we could do that. And as we have mentioned that it's very limited to one geography, and that scale up options could be, more to other geography in other faith-based leaders, those who are not involved, to get their perspectives as compared to those who are involved in that. But we involved the faith-based leaders to know about that, how we can improve our interventions and reach to the unreached at that, different communities and different geographies. So yeah, thank you.
Thank you so much, Dr. Arpita. It's a wonderful study, and I'm really, really impressed with the way you did the qualitative data analysis. I really like that. You did the thematic analysis, and I can imagine how difficult it is sometimes, and sometimes it's frustrating as well. But you summarized in a very well manner. I just wanted to know that as it was an intervention study, we all know that intervention study is always having much more challenges rather than other type of studies. As it was different particular geographical situation. So can you please share with us for our learning what kind of challenges you have faced when you have implemented the intervention study in Bhutan? By the way, I'm Dr. Fariha from Bangladesh. Thank you.
Thank you so much, Dr. Fariha. As you have mentioned, we faced lot of challenges. Actually, when we reached to the survivors, they hesitate to participate in that study, to come in that place and sharing their knowledge, because now they overcome that situation, or else they were, placed at the shelter home. They were hesitating to share their stories. It's not, easy to get the verbatims or the in-depth, things from them. But, and we actually did kind of rapport sessions before actually onset of that particular, in-depth interviews. So that 1 or 2 weeks, that rapport session, so that we can, very much familiar with them, so that they can explain their story. It's very difficult to explain. And as I mentioned, we use the vignette kind of, story to share another women's perspective, and then they opened up and, shared their stories. But it's very challenging to get all those things. And, due to time, but if we can publish this, we can share, most significant change stories that they have narrated during interviews. Yeah, thank you so much.
Any other question?
Thank you very much for your nice presentation. I just want to know whether there is any conflict of interest. Those who did the study, are they the ones who did the intervention as well? Because they can have an effect on the successfulness.
So much for this question. That's why we actually contracted Population Council, the independent knowledge management, those who are not involved in any interventions, because we know that IPPF and Renew, they are doing that intervention in the ground. So if we do, that's the conflict of interest. That's why we hired a contracted Population Council from that, individual third eye perspective to evaluate that overall intervention, not by us. Yeah, and we did that, IRB things, and they had also different questions regarding, as you have mentioned. Yeah, thank you.
Any other? I can only entertain one question more. Thank you very much, Dr. Das. Shall we move to the second presentation, Dr. Kanti Hettigode, on exploring the effectiveness of the awareness of video? Any questions to her from the audience?
Hi, this is Anaya
Yes.
from IPPF Saro. So I just wanted to ask you, what was the reaction of the professors from the university that you did your research in about the LGBTQI students and the acceptance from the professors and the teachers and the professionals?
Yeah, thank you for the question. But in our study, we did not include any lecturers or professors. It's only the undergraduates. But we understood that we need to extend this to our staff as well, our professors as well. I won't be surprising if they have very, very poor knowledge and attitude, because when it comes to sexuality and the sexual orientation, we are very, very conventional still. But there are young lecturers, I think, as Doctor said, if we interview the young lecturers and professors, yes, they might have, but we didn't include any of them in the sample.
Any other questions?
Yes.
Yes.
Just wondering now with these students, what was their, I don't know whether you measured it, home attitudes towards their sexuality? Were they feeling they were stigmatized, etc. at the university because the home environment was also not supportive? Whether you have touched that, I don't know.
For actually, we only had in-depth interviews with the those who identified themselves as homosexual or transgendered. Only 5 of them as a focus group discussion. So I think it might have influenced, but we didn't have any particular question. Have they experienced the same stigma in the external world? But as you said, there can be some kind of influence from that as well, because they perceive that others will like exclude us, that self-exclusion because of that perceived attitude or something. Yes, it's a good question. We need to include such question in future research, I think. Yes, home attitude also might. And some of them actually, they are home people. They don't know that they have that identity. When they are only in the university, they act like and they behave like that. That is also there. When they go home, they try to be the expected role in at home environment.
Any other questions?
Thank you very much for that excellent presentation. Do you have any intervention plan? Because I also have some personnel working with HIV patients, so sometimes experience that they have to exclude from the degree program because of the stigma and discrimination. It's very pathetic. They are really very intelligent people. So are there any, as you are working in the university, any program or any intervention to help such students?
Yes, actually, through our university has a university counseling unit, CAPSU, and it actually entertain and invite any kind of student to come and seek help. And we have few girls who have converted to boys in our hostels. We have actually big dilemma whether to put them in a boys hostel or girls hostel. There are a lot of issues, but university accepting them, and they are students and they are in the hostels and their friends are now supportive. We have very good cases, few cases as role models who identify themselves. They have been brave to go through the surgery, sexual reassignment, and they are living in the university with new identity. We commonly welcome all the students for any mental health thing. Actually, for homosexual, I myself have counseled several couples, boys and girls, who identify them as homosexual. Me being a university counselor, senior lecturer, they are open to come and seek help, and they know we are welcome them, and there's no discrimination. So, but no formal program yet, but we are increasing the awareness using, I'm planning to use the same video and we will translate and we will show it in the orientation program and for others to know about themselves. But for the psychological support, yes, we are actually welcoming them for our services.
I have one question. We are now actually, as a university academic, we are now only recognizing this entity in universities and facing the problems and trying to find solutions. I'm wondering, with your experiences now, we know with the age, the changes are starting to appear from adolescent to youth, and they may go through a phase and then find themselves which category they really are. My dilemma is whether this is as a psychologist, I'm asking whether which one is a temporary kind of a phase or is it a permanent, that assessment and getting the help that is needed for that student to prepare to the environment and to prepare his or her psyche. Are we, as university academics, are we empowered is my question. So from a psychological part, Can you enlighten us?
Yes, thank you, madam. Very important question, but I know the answer has to be very lengthy. But to make it short, so when we talk about homosexuality or sexual orientation related things, there can be some temporary trends or learned behaviors or something like that. But we should not forget that there are some portion of this community who are biologically have that tendency. But there are a lot of students who have that trend and they are just exploring and identifying themselves as homosexual. But whenever we encounter such a student, whenever we have the counseling session, so we have some mechanisms to know whether they are truly homosexual or they have learned this behavior. This is the only way they can entertain their life, or this is the only way they can enjoy sex. So we explore that and we kindly tell them that it's too early to actually conclude that you are homosexual, but you can enjoy it with the consent of your partner, but not to conclude. Life is very open than you think. So that's what one. But when it comes to transgender, again, I think even Sri Lanka, when we do the sexually reassigned surgery and all those process, there's a window period for them to decide whether I really want this or not. So for that also, I think 1 year counseling is a must kind of thing for them to decide. Is this something because I hate men, that's why I want to be a woman, or is this because I hate women, I have some grudge with my mother, so I don't want to be a woman anymore, something like that. Through our counseling process, there are a lot of psychological theories and explanations about this thing. Actually, in our video, we talk about all those things in a little way. So we accept them, whatever the identity they come with, and then we ask them to be a little bit open. We open the windows and give the scientific things and other options. Some people halfway through decide, yes, this is my psychological issue, this is not something biological. I am happy to be as a woman or man, but I have this certain thing to sort it out, so we can help in that way. But yeah, it's a long process.
Thank you very much. So let's move to the third speaker. That's Mr. Anuziman and from Bangladesh, talking about the Hijra and transgender communities. Any questions to Mr. Anuziman?
Thank you so much for this amazing presentation and study. I have two questions actually. What is the government stance on Hijra violence cases in Bangladesh? I've worked with people from Bangladesh before as well on Hijra culture. I belong to the Hijra culture from Pakistan, so we have connections over there. And the other one is, does the violence from gurus, because the Hijra culture have guru chela system, and does that comes under the gender-based violence cases? And how do you guys treat those cases?
It's very tricky. And
I know.
Yeah,
I have a guru. I am a guru, but it's a reality.
Yeah, that is the reality. Actually, in Bangladesh, the culture, Hijra culture, there is a guru parampara, and they have their own language, they have own customs. So that sometimes other people, other guys, those are under the guru, sometimes they face the difficulties. And some guru also helping to prevent the gender-based violence as well. So that it's a mixed and it is a complex situation actually.
Sorry, just clarifying. Do you guys treat the violence cases from the gurus? I am a Hijra, I can say that. And they cannot.
Yeah, sometimes,
So do you guys treat the cases or just ignore them or give it to them to solve these cases? I know this is a tricky question. But.
Very important question. Yeah, as a community-based organization, we also face, significant level of problem. I mean, pressurized by the gurus as well. So in some critical cases, what we do, we follow the referral mechanism if there is. So we just we do have referral pathways, and with some friendly organization, those who are very expert on legal issues as well as in human rights issues. So we try to resolve it rather than intervening us through them. So through the referral mechanism we do. Yes, you are right. There are cases between gurus and chelas, but how dominated the chelas are by the gurus. So sometimes they also fear to speak about. So yeah, we have to follow that mechanism in terms of resolve that.
Thank you so much.
One question I want to ask, where are you regarding the act you talk about that you all are in the process of developing the law part about the rights of the people and the act regarding, so are you in the process or have you completed, gone up to the parliament, or what is that?
Actually, thank you so much. This is a very good question. Actually, the Transgender Act is the process, under the process, not in the parliament. And the Social Ministry of Social Welfare Department of Bangladesh initiated to this kind of law, for formulating this kind of law and consultation with different stakeholders as well as the community people. But still is in the process.
Thank you, because in our country also we started an act and it was thrown out when it went to the parliament. So all of us are in somewhat a similar boat, I think.
So they can go through the gender change process that is accepted by the Minister of Health, and also they can change their identity also. That is legally.
At least this the health sector in our country, we can assure we are much better. But when it comes to the legal sphere, there is a lot of things that need change. Any more questions, or shall we move to the other person, because almost we are closing to the time. And next one is from to Ms. Sumatipala, Chanika Dilhani, that's on protective factors for intimate partner violence during COVID-19 pandemic. Any questions to Ms. Dilhani from the audience? Anybody? Everybody wants to go? Okay, I have one question.
Yes.
What we saw, I'm a forensic medical person, during the COVID-19 pandemic, the type of violence, severity of violence was increased and the complexities have increased, and solving and bringing help is much more difficult.
Yes.
So, with your findings, if we are to address now 2024, COVID has gone, but how to put your findings to the future?
Very good question. Actually, my concern is in Sri Lanka during the COVID-19 pandemic period, there are a number of frontline workers. But basically looking at the prevention of COVID-19 pandemic and the virus prevention and so on. But a little bit less concern about the psychological support and so on. So if we can include some psychologists as well as social work into this mechanism and accepting them as a frontline workers and working collaboratively, I think it would be more effective, and identify risk factors and act before what has happened is the most important thing, because we can still implement number of activities to increase the communication between partners as well as how we can improve their skills. For example, I can say we can give some small pre-counseling session before they are going to marry. So such components, simply we can implement number of changes in Sri Lanka.
Thank you very much. So I'm rushing to the next author, that's Niranjala Sumatipala, about the health-seeking behaviors from facing sexual violence by intimate partner violence in Sri Lanka. And she presented from the Health 2019 National Health Women's Wellbeing Survey. Any questions to Ms. Sumatipala?
Thank you for bringing up that statistic. Is there any possibility for you to do like follow-up studies with these people? Can you locate them? Because maybe you haven't got the consent from the people to get their data, but it's worthwhile, like, when people fill the questionnaires and when these survey people fill the questionnaires, there may be a lot of bias, pro and against. But if we can do some like in-depth, like, something follow-up studies with those statistics will be very useful. Actually, when it comes to help-seeking behavior, we need to promote it. Yes, any idea to follow it up?
Yes, thank you. Very interesting idea. Actually, this is study based on secondary data. So we cannot follow up these people, these respondents. But in future, we can improve this research, and we can, especially they are respond the questions in questionnaire. Sometimes they didn't tell truth because of this. In this secondary data, we see they refuse answer. They don't give some questions. They don't give answers. So very interesting idea. And in future research, we will consider that, and we will do in future this kind of research. Thank you so much.
One quick question, that actual reflections, not the questions. As you have used that descriptive statistics where you have, mentioned all those. So if you can run a kind of, multivariate, regression kind of thing, so that you can get that all the predictors or the determinants, what are actually affecting, and increasing this thing. So if in future, if you would like to do that, would be helpful.
Yes, thank you. And in this situation, the problem is the respondent sample size is 148. Sample size is too small. In that case, we cannot do some, as you mentioned, regression analysis and multiple logistic analysis. That's why we limited to chi-square statistics. But in future, we will consider that and we will do some more statistical analysis. Thank you.
Thank you. I'll quickly go to the last person. That's Dr. Nalaka Kulatunga. And as an academic, this is the challenge. So we know when I came to medical college, we were never taught child abuse, gender-based violence. And in 2012, somewhere through the SLMA, all the curriculars were looked at and we included a gender topic to that. But still, from your study, we understand the intern doctors. We are still not even curriculum level, we are not addressing. It's something which you brought. Other than through the curriculum, any bright ideas for change this difference from your research?
Thank you, madam. Actually, the second part of the study, we inquired what they think, why they don't have this knowledge and why they have different attitudes. So most of the doctors who responded was that their first choice was they were never taught about this one, as madam told. And also we asked what are the possible ways they prefer. So again, the undergraduate was their first choice. But there are other options as well. Informal education as well as sensitizing the community, because doctors are also the product of a community. So community, if they don't have this knowledge or this sensitivity, this empathy, so it's difficult to expect that from the doctors as well. So I think it's should come from the young age, not young age, as kids also. And so there is a informal education, there is a large part we have to do. Informal education can be part from media, part from our day-to-day conversations, any opportunity. So there is a wide variations of opportunities we can use, but hardly I think we are using that one. Medical curriculum, yes, of course, most of the Western countries, they have incorporated, but they have also started to incorporate it after 2000, 2010, like. So we are not that far behind, but we have to start that one also.
Any other question from the audience?
Thank you so much. I find it really, really important, presentation, and thanks for the initiative. Good findings as well that can be replicated in other part of that, region. My question is, it's sort of online based interviews and information you have gathered. So what was the mechanism in terms of, sort of disseminating the information or questionnaire to the potential respondent?
In Sri Lanka, this is done on the doctors who are employed by the Ministry of Health. So Ministry of Health has a database. So they are having a database, and what we requested was our sample size is 384. So we asked them to randomly select 384, send the questionnaire we have prepared. So it's a Google form we have disseminated. As you see, the response rate was quite modest compared to the other two studies done in Sri Lanka. One is done on the doctors, but it was not an online one, it was on site. It was disseminated, and we specifically mentioned we don't collect their personal data, it's anonymous data collection. So that's how we disseminated the questionnaire to the sample.
It looks like no other questions. So shall we wrap up the session? And thank you for the active participation. All of you all were wonderful. And now we are heading for the awarding certificates.